Well, thanks a lot for sticking with us. Welcome to Health and Wellness right here on K24 this morning with me, Shiko Kaitani. Today on the show, we've got something for you. If you've been struggling with balding, you would be surprised how balding, or at least those balding patches and even a weak hairline, can affect one's self-confidence. After all, your appearance does matter. And so today on this show, we welcome Dr. Arshni Malde, who is a specialist in aesthetic medicine, to discuss hair loss and, most importantly, what available treatments are in the market today. Dr. Malde is also the founder of Tia Clinic, and our question of the day to you is, what are your concerns when it comes to hair loss and treatment? Start talking to us. Of course, at K24 TV is how you can reach us. Remember, our WhatsApp number, pretty active. We'll be taking a look at your feedback in just a moment. But Dr. Malde, welcome to the program.
Thank you so much.
I'm really happy to have you, because this is one of those discussions that have been, at least concerns that quite a number of viewers do have. And so before we begin, I want to ask my director to play a clip for us, and then we can get talking.
Sure.
Hi, Dr. Malde. We can see the before and you preparing for what is about to be, or at least a hair transplant in that particular clip. So explain to us, what really is a hair transplant?
So a hair transplant is basically a natural way of hair restoration for people who suffer from balding.
Yeah.
You often see that most people, males or females, start to bald from the front, or they're bald all the way till here, or you bald at what this is called the crown.
Yeah.
And so we're trying to restore hair, wherein we're taking your own hair from the back of the head, which is called the donor area, and all we do is remove one hair at a time from this area, because this is the strongest area actually.
Yeah.
You often see that when somebody's balding, they don't bald from this area all that quickly. I mean, you'll see an 80-year-old male or 80-year-old woman who's probably balded all the way, but this hair is still there. So that's the strongest, lasts almost a lifetime.
Yeah.
And that's where we remove the hair from and reimplant in the area of baldness, because it's a natural way. It's going to grow back naturally. You can cut it, style it, do whatever you want to with it, as opposed to any kind of artificial restoration.
Right. And, we'll keep playing at least some of the clips from some of the procedures that she has done, and also just show you the before and after. So I want to ask my director to just keep those images rolling. But Dr. Malde, it's kind of almost impossible to believe that you can actually uproot a strand of hair and put it in a different section of the scalp, and it will just grow like nothing happened.
So basically, it's more like any other organ is going to be transplanted in the body. But this is your own. And all we're doing is, for example, you can visualize a plant. You want to remove a plant from one area and you're replanting it in some other area. It's going to grow as long as there's the water supply and the soil and the fertilizer and everything together. It's still going to grow.
Right.
So that's exactly the way a hair transplant works. We're only removing the follicle or the root per se, and we're reimplanting in another area, and it's supposed to grow. grow, because there's still going to be blood supply, there's still going to be some artificial fertilizers.
Yes, the nutrients now needed to keep that hair.
Absolutely.
Because the assumption would be once you've actually uprooted it, doesn't it die in the process of the transplant?
Exactly.
Yeah.
So what we do is we implant what is called graft. It's not just the hair on its own. So a graft consists of tissue. Let's go back to the example of the plant. You do uproot it with some soil around it. You don't just uproot the plant on its own.
Right.
Exactly the same way we're uprooting the follicle with some tissue around, and that's the graft.
Yeah.
So that allows for it to have the blood supply be connected back, and the tissue will keep it live wherever we've re-implanted it. Yes.
All right, so as you can see, that is the after the procedure. You can see there has been quite a change in the before and after. And so typically for such a situation from, you know, let's call them the model in your video, there's the balding here. So this is the section that you were working on right here at the front.
Yes, so for him, he had undergone a transplant before, not from my clinic, but unfortunately it had failed. I think we'll speak about this later. But yes, so we tried to restore the donor area, which is the back of the head. And then we had to re-implant. But as you can see, his hairline is faint till the crown. So in his case, he's going to be undergoing 2 transplants, 1 4 months apart each. And so we've only tried to fill the first half because that aesthetically is what is acceptable. So yes, we have filled in half, and then we see him after 4 months again to fill in the other half. And we're getting the hair from the same place.
Right.
Yes.
Okay. You know, the thing is, many people would probably wonder, this is such a luxury treatment. Why bother going through all of this? But it goes back to what I said in the intro about how hair loss really does affect one's self-esteem. So can you tell us about the increased interest in hair restoration, especially with men? Because you'd think it's just women who have challenges with either their hairline or with hair loss. How does this really affect someone's confidence?
Well, I always say your hair is your dignity. So if you don't have hair, you don't have confidence. And males, you know, men these days want a head full of hair because I think that brings up their confidence. Back in the day, they were okay being bald, and Kenyan men would just shave off and be completely bald and just live that way. But if you see the younger generation and the younger crowd, they want that afro, they want that head full of hair. And then if you see a receding hairline and you still have big hair, that's going to look really funny. I think even women or girls want, you know, their boyfriends or husbands to have a head full of hair as opposed to them being bald all the time. So it's a trend. I mean, it's not just the head on the hair, the hair on the head. It's the beards as well. That's a trend as well on its own. So yes, when it comes to transplants, we're doing both the head, the beard, because that's what most men lack, and you know, that's what they bald from. So.
All right, remember, dear viewer, we are asking you about what your concerns may be when it comes to hair loss and treatment. If you've got any question for Dr. Malde today, why don't you start sending them through our social media platforms? WhatsApp is right there at the bottom of the screen. If you want to call in and talk to Dr. Malde, why don't you? Let's now understand the reasons behind why we bald. Dr. Malde, is it purely genetics or is it lifestyle?
I would consider both. It's not genetics as much these days. I often see young men walking into my clinic and you know, complaining that, oh, my father has a head full of hair, and why am I balding? So we've often realized that it's a lot of things that come into counterpart, that it's your genetics, it's stress, it's lifestyle, eating habits. We often find chronic smokers, chronic drinkers balding much more faster than anybody else. And yeah, all these factors play a role altogether. But I think the most common factor these days is stress, and that really causes most men or women to bald.
Wow, very interesting. Okay.
So I've had one of my patients was 18, and he was my youngest patient who we did a transplant on, and he was as bald as almost a 70-year-old.
18?
Yes.
Oh my,
So you can't say that's genetics, because back in the day again, men used to start balding at the age of 40, 50, and now you see all 18 to 30-year-olds walking into my clinic every day, and they're all just quite bald. I would say 60 to 70% bald.
Wow, that is interesting to know.
Yes.
I want you to have a word, or at least speak directly to women at this particular junction, because we did talk about this even before the show, how we are losing hair, especially in our temple areas, simply because of styling. And I guess it's probably something that we don't take too seriously, and then wonder why are we losing our hair.
So yes, first things first, there's just not that realization point for most women.
Yeah.
I think they've also silently just accepted, or it's more of ignorance. But most Kenyan women do a lot of braiding, weaving, and that is called traction. Traction is pulling of the hair, which makes you lose all the hair permanently, specifically the hairline and the front, what you speak of, the temples actually.
Right.
So this is because of all the chemicals as well as the braiding, as well as the extensions, the weaving or the stitching, as what is done with most extensions. There's a lot of pulling that happens at that time, and it's causing trauma to the hair, and that's what makes you lose the hair completely.
Right.
Also the chemicals and the heat that most women give to straighten their hair, because they're not so comfortable with you know, the natural look.
Yeah.
And African hair being really curly, I think most women want to straighten it out.
Yeah.
But I think again now most young girls and, you know, young ladies are accepting that they want that afro, they want that curly hair back.
Yeah.
And now that realization is there, and they want us to, you know, restore, and they want to have it in a more natural way, because we can see that trend where human hair is in place now, and people are spending a bomb on it. So going back to what you were talking about, luxury, yes, hair transplants is luxury, but it's human hair is also luxury at the end of the day.
It is luxury, and we'll pay for it.
Exactly.
Well, typically we are paying for your hair. Okay, so let's see what some of the questions we have that are coming through WhatsApp. Remember, we've been asking, what concerns do you have in regards to hair loss and treatment? At K24 TV is how you can reach us. We want to sample some of your text messages, and our team is working on it at the back. But we've got someone who says, good morning, just to ask the doctor, is the hair transplant painful, or you first inject someone to avoid pain before the process? Speaking about the fears, Daktari, I'm sure they are there, because it really does look painful, and I still want more of those clips, director, so we can actually share with them. Let her answer that, and then we can get to more of the text.
So no, it's not painful. Obviously, any kind of treatment or anything that you do to your body would have a slight discomfort.
Yeah.
But yes, to answer that question, we do inject anesthesia, and we're only injecting anesthesia which is local, which means only the area that we're working on. So to start off with, we'll inject anesthesia in the donor area.
Right.
The patient will have a little bit of discomfort, but it's not painful per se. And once it's completely numb, you don't feel anything throughout the entire process.
Okay. All right. Sorry to cut you short there. We've got a call on the line. Martin from Embu. If you can hear me, good morning. Do you have a question or a comment for Dr. Malde? Hello, Martin.
Hello.
Yes, Karibu.
Thank you.
Go ahead.
Okay, I have a question pertaining with the youngsters. Yeah? Does it take any impression if you start by, in case you want to have a rust on your head?
Sorry, I'm going to ask my director to turn up my monitor, kindly, and then just repeat your question, Martin.
Okay, I was asking.
Yeah.
For example, like I want to get a rasta, and I don't have long hair. is there a problem if I started by implanting somebody's hair to short comb it?
Oh,
and
okay.
Then my hair grows in it. And then,
okay. Okay.
Yeah.
I get you, Martin. Thank you so much for your question. I don't know if you understood what he said, Dr. Malde. Is it actually possible to transplant hair from another individual onto your patient and actually have natural restoration?
Unfortunately not.
Yeah.
Because that would require too much of a complex process. You know, for example, if you're doing a kidney transplant,
right,
there's a lot of pre-process that happens in terms of checking the blood group and checking if the donor is actually compatible with you. And unfortunately, we haven't been so advanced in technology when it comes to hair transplants. So.
Right.
There hasn't been a way wherein we've removed hair from somebody else and implanted. And then again, there's that chance of rejection, like there would be for any other organ, because you're taking it from somebody else. However, in a hair transplant, there's no chance of rejection because it's your own hair. But I think his concern was that he may be completely bald.
Yeah.
And, you know, sometimes they don't realize, but yes, they do have slight hair at the back. And it's just because they've constantly been shaving, you know, all throughout all the years.
Yeah.
They don't know that they still have hair at the donor area. And that's why it's necessary for someone to come in for a consultation, because I would be able to evaluate and tell them that, yes, this is possible or not.
Right. Okay. We've got a caller from Nakuru. Omolo, good morning.
Good morning to you. How are you?
I'm fine. Thanks for calling in. What is your question today?
Say hi, sorry. Okay. I'm wondering, because I got the program going on,
Yes.
and I got a bit interested. Do they have the physical address, and in terms of cost, can we really get them?
Okay. Absolutely. You'll definitely get that. Thank you so much for that, Omolo. One of the frequently asked questions, Dr. Malde, is the cost implication surrounding such a procedure. First of all, when you talk about, you know, taking hair from the donor area and taking it to the part where it's needed, could you actually explain step by step? When you mean you're removing, it is strand by strand.
Yes, it is. So I'll explain to you how it starts. We often start with a consultation, wherein I'm evaluating and actually seeing how good the donor area is and how much of the recipient area has to be restored. And then from then on, we give them an idea that, okay, you will need 4,000 strands or 2,000 strands. It often so happens that you require anything between 2,000 to 5,000 or 6,000 strands. We call them grafts because that's tissue together with the follicles, but I'll just call them hair for now because that's going to be easier to explain. So yes, when it comes to cost implication, we're charging per strand or per hair. Just to give an idea, we do 100 shillings per hair.
Right. Please don't. 100 shillings per strand.
Yes.
Okay. And what is the minimum requirement to transplant?
There's no minimum requirement per se, but yes, if you're losing your hairline, then you do require about 2,000 strands. And if you're completely bald all the way till the crown, then you would require anything between 4,000 to 5,000 strands.
Yeah.
So just going back to the process, once the evaluation is done and you book the procedure, then we go in through the entire hair transplant process, wherein we're injecting anesthesia at the back. We numb the back area, remove one strand at a time. It's then put into medication. We clean, we count, and we're making sure we count each and every strand. So it's 4,000 hair, then we're counting 4,000 strands. And then we anesthetize the front area or the recipient area, and all the hair one at a time is implanted into the recipient area.
Right.
So this takes about 6 to 7 hours. That's the whole day. But again, you're completely normal, you're walking, you know, you can do anything you want. We give you some breaks in between. So there's no discomfort whatsoever in terms of pain or, you know, just wanting to lie down on the bed the whole day, nothing like that. And you have that comfort zone, and yes, it takes 6 to 7 hours, but it's restored completely.
Wow, amazing. Okay, let's take a look at another question that came in, I saw on WhatsApp that Daktari can address. Hi Shiko and Doc, what causes hair loss on hairline during breastfeeding? Very good question. So a lot of women who have just had a baby, given birth, or even pregnant, expectant mothers tend to lose a lot of their hair, Doc. Do you see these cases quite a bit?
Yes, it's very, I see this really often, and it's very common actually. And we see that there's a change in hormone levels, and this is the reason most women actually during pregnancy have really good hair. The hair becomes even much better than what it was originally. And then post-pregnancy, again, hormone levels fluctuate, and that's the reason for the hair fall, and that's the reason that most women lose hair while breastfeeding. So I come to see, you know, I mean, I see patients every day, or I see patients every so often who say, I've just given birth and I've lost my hairline. However, we don't do transplants while you're breastfeeding because of the anesthesia. So yes, you would have to wait until you finish breastfeeding, and then is when you can come in for a transplant.
But you know, in such a situation, Doc, you would imagine that the hairline would just restore itself once, of course, you're done with that you know, season of breastfeeding. But it's not always the case. Some people, it doesn't really come back.
No, so what happens is once you've lost your hair with whatever reason, be it breastfeeding or chemicals or braiding or traction, there's trauma that's happened there, and the hair's not going to come back so soon, or the follicles have just died out, so the hair's not going to come back at all for that matter. And that is the main reason that, you know, somebody would require a transplant actually. Yes.
Okay. Another question, please, before we get back to more of the frequently asked questions that I want to throw to Daktari. Well, it says, wow, if I never had a beard, can hair be transplanted on the face? Wow, what a question. What's the cost of the procedure? Is the transplantation painful? Any side effects? Can one transplant gray hair? Okay, Hadley Muchela, look at question 1. How do you do that?
Yes, it's possible actually.
Really?
Yes,
from the beard to the scalp?
Both ways.
Okay.
We do from the scalp to the beard, and we do from the beard to the scalp as well. However, I often choose not to do beard to scalp because the course of hair is different and the density is also different. It's much less. So only in cases of rare emergencies wherein we feel that we just want to fill up a little space and we need some hair from the beard, then yes, we do take hair from the beard and transplant it back onto the head. But from the head to the beard, it's possible. We do a lot of those cases, and yes, you're going to have a full beard then.
Okay. Well, good for you. We've already answered about, you know, the cost of the transplant. Daktari mentioned that it is 100 shillings per strand, minimum being 2,000 strands that you're going to be requiring. I know it could be a bit of a costly transplant, but worth it if you do want to invest, obviously, in your look. When we talk about the risks involved, that really was one of the questions I did have for you, Daktari. What are the risks involved around hair transplant, and what are some of the frequently asked questions that even your patients ask you before they walk into the procedure room?
So I wouldn't say there are any risks involved, actually. There would be a failure from the transplant, but then again, that's just 1% of transplants that can fail, and the only reason that transplants fail is because the patient hasn't taken care of what they're supposed to do post-transplant, and then you know, it's compromised on the results. So in my entire career, I've seen just one hair transplant fail wherein the patient was living in really unhealthy conditions, and he caught a fungal infection, and that compromised on the results. But like I mentioned earlier, you know, there's no reason for a hair transplant to fail because it's your own hair. There's no chance of rejection, there's no chance of it not growing or anything like that. And we make sure we give utmost care. Even post-transplant, we have a few things that we do, a few protocols that are to be followed post-transplant. And the hair just grows. There's no reason for it not to grow.
All right, so Dr. Arshni Malde is here with us. Remember, she is the founder of Tia Clinic, and she does specialize in aesthetic medicine. Today, it's all about hair loss and treatment. Yes, there is hope out there. If you've got any questions for Dr. Malde, why don't you continue sending them in? We're going to be taking a look at that in just a few, including what aftercare really is like for someone who's had a transplant. What do you really need to know? At K24 TV is how you can reach us. Remember our WhatsApp number at the bottom of your screen. Should you wish to call in, like I like to say, we'd love to hear your voice. Stick with us. There's more to come.